Hello, I'm Dr. Rafi Romano. I'm very honored and pleased to present to you my 5th lecture in the series of movie presenting lingual orthodontics in general and jaw bracket specifically, jaw bracket by a dental company. Now, we have already discussed the type of the bracket, how we do the plaster model bracket placement, how we transfer the tray, how we bond the bracket in the mouth. Now comes the treatment itself. We will learn today which pliers to use and especially how to bend wires. Bending wires is probably one of the most essential skills orthodontists need to have. I will teach you, I'll try to demonstrate you with videos, step by step, all the types of bending we will need to do. Our learning objectives today is to know all the different lingual pliers, to learn how to bend wires for various teeth movement, and the question always comes, should we bend or rebond? Lingual pliers are not so different from buccal pliers, but they are more delicate and more designed to reach small places because we have small interbracket distance. The light wire plier, which is one of the most popular pliers in orthodontics, comes in version which is called 140 or 141, where it is more elongated and more narrow. So this is a light wire plier that I'm using. I have a detailing step plier, which is one of the most popular in my clinic. As you will see, this plier will create for you a step down and step up, or step in, step out, in a very designed and accurate way. It comes in various sizes of 0.5 millimeter, 3/4 of a millimeter, or 1 millimeter for very big bends. There is the 3-prong plier, one of them designed for nickel titanium wire bend. We have the cinch back plier that create for you the cinch back behind the molar when we need to bend the wire and lock it. There are special design for these cinch back pliers for lingual, which is very small. There is loop forming plier, where you will see it in the hands-on demonstration. Very useful to create stop arch wire or to create loop to close spaces. It comes by different sizes of the loop. There is arch form plier that gives you all the round of the wire, so you can take a straight wire and make it to become a lingual arch wire. We have a distal end cutter. It's quite the same like the regular distal cutter, but it is 45 degrees angulated and very small, so it helps you to do the cutting in the lingual area. Now, we will learn the difference between passive bends and active bends. What is passive bends? Passive bends is to enable the wire follow the shape of the arch. Because the lingual arch has few places where we get a very marked or very big difference between the width of the teeth. One of them is between the cuspid and the premolar, and the second between premolar and the molar. There are bends which are created in the wire and they are passive. They only are designed in order to let the arch wire follow the shape of the arch. There are active bendings. The active bendings is to apply force. The force can be for rotation, for overcorrection, to compensate in and out difference between brackets because of different width of the teeth. These are called active bends, and we will learn how to do each one of these bands. We will try to give you hands-on demonstration on all these different 9 bands that you will see one by one in the next few slides. The first band is the passive band, which we call usually the mushroom arch form band, because the arch wire looks like a mushroom. And you will see in the demonstration that we can place this band more close to the cuspid if you have spaces, or more close to the premolar if you have crowding, because the crowding needs as much wire as possible, so we will place the band as close as possible to the premolar. In spaces, we will get extra wire when we will close the spaces, and therefore we will place this band as close as possible to the cuspid. There is another band that we can make near the molar, between premolar and molar. One of the ways to avoid this band is to place the bracket on the molar more mesially, where the shape of the molar becomes more narrow and more similar to the premolar. And in that way, you can avoid making this passive band near the molar. You can see here the molar band, and you can see the cuspid band, which create the mushroom-shaped arch wire. In order to prepare the first wire with the passive bands of the mushroom shape, I have here 2 wires. One I will make for the upper, one I will make for the lower, and 2 models with joy brackets ready for them. These models belong to my assistant, which are going to get the joy brackets hopefully next week. In order to do these bands, I'm using the light wire plier. As you see, comparing to a different light wire plier, the beaks are much longer. This is very helpful for lingual orthodontics. This is a 140 or 141, depends on the length of the beaks. I have here a distal wire, distal cutter, that is very small, designed for lingual orthodontics, and a small wire cutter straight, which sometimes I use as well. So, first of all, we take the wire and put it on the model, trying to see if the shape of the arch looks almost the same like the shape of the wire. And in this case, we are almost okay. Don't forget that this is the first wire, so the wire has some flexibility. Usually it's a nickel titanium wire, and we will not get all the transverse effect from this wire. So I place the wire in the anterior slot. Then we take a pencil designed to mark signs on the wire, and I will mark exactly where I want the bend. In this case, I didn't bond a bracket on the cuspid, because the cuspid has overlap and I cannot place a bracket correctly. So I can place my band somewhere between the lateral and the premolar. The same, we will go here and we place a mark over here. So we have now 2 white marks, one over here and one over here, and I will take now the light wire plier, hold it, then give a 45 degrees bend inside. Then I change the position of my hands, and depends on how big you want the bend to be. You want a small bend, I hold it very close. You want a bigger bend, I hold it here, and then I push the wire out. It is very important that after you do this bend, the posterior part of the wire will be parallel to the anterior part, meaning that we come back to the same line. Now I repeat the same. I can see the sign over here. I put a band inside. I change the position of my hands. And I do a bend outside. Make sure that these are parallel. They are not parallel yet. So I correct it a little bit. Now, after I do it, I try to make sure the wire remains flat, as you can see here. Okay. And as you can see, if you carefully check, the right part is a little bigger than the left one. This band is a little smaller than this band. Usually you have to make sure that they are symmetrical. So now we can check the wire and see if the wire fits to its purposes. Now, the wire now is placed very passive, and you can see the line, the posterior line, which will actually guide where the teeth will go. You can see that I have some expansion in the posterior part of the wire. If this expansion is not required, I can take now these two parts and get them a little bit inside. Let's look at it again. Okay, now it is much better design. Okay, so this is our first wire, which is the mushroom wire. Now I can add also, if you can see here, for example, in the left side, you can see that the molar is much wider than the premolar. So again, you remember that we are discussing now passive bands, and passive bands are designed in order to fit the wire to the shape of the arch. So I can now add one more band. So now I have two bands, one between cuspid and premolar, and the other one between the premolar and the molar. The only difference in the upper is that we have to design the wire to fit an upper arch versus a lower arch. So I take the wire and I open the wire to be more wide to fit an upper arch. Now you can compare the two wires, and you can see that now we can repeat the same procedure with an upper arch. Here we will make an in band and make the wire fit the premolar, and same over here. Let's make it just for demonstration purposes. I can hold the wire and then take the plier, put it in the middle between the two teeth and make the bend. And same for the left one. It is always recommended to do the bands when you have long wire and not short, because then all the changes you want to do in the wire are very easy to do as long as the wire is long and easy to bend. Okay, let's see it here on the model. Okay. The next band is an active band. We in this band aim to proclaim the teeth, to move them forward. We are not discussing here if this is a good treatment modality, if you prefer in your cases to do proclination, but in case you decide to do proclination, how we do it. So one of the way is with this mushroom band that we have created before, which was passive, we can make this mushroom band between cuspid and premolar to become active. How it become active? If we make this band more close to the middle of the premolar. Now when we make it close to the middle of the premolar, when we will push it forward and tie it, we will get proclination in the wire. You will see it in the hands-on demonstration coming after this slide. The second band is a proclination band. First of all, as you can see, it's a matter of treatment decision when we want to do proclination, where the proclination is going to occur. If the posterior part looks quite nice and we want to proclaim the teeth from cuspid to cuspid, then I will create my stop between the cuspid and the premolar. How do we do it? I take the wire, I place it in the anterior part, and I mark my mark on the wire in the middle of the premolar. Okay, not between these two teeth, not close to the premolar, but in the middle of the premolar. Then I do the same in the other side, in the middle of the premolar. I hope you can see the two signs. Now I take again the light wire, which is probably the most used plier in my clinic, and I go to the band, to the sign, and I make again my mushroom bend. The same, I look for the sign. So I have now almost the same wire we have bended before, which is the mushroom wire, but now this is not a passive wire, this is an active wire, because when you put the wire now, and I have exaggerated a little bit, but if you put the wire now with the stops mesial to the premolar, as probably I will put in the mouth, you see what happens now to the front of the wire. The wire gets a shape of the new position of all the front teeth. Now the front teeth will be located around the most protruded central incisor. So in that way I can get space because all of them will be aligned on a bigger arch. I will most probably get some side effects. Side effects can be rotation of the premolar because the wire lean on this premolar, and I can get some exaggerated force on these centrals, and therefore this band recommended to be to do on a very flexible wire such as 0.012 or 0.14 nickel titanium, which will give very minimal force. Same can be done, of course, for upper arch. You can see here, this is for minor proclination. I can, of course, bend a new wire for this upper arch. A second option of an active bend is to do proclination from the back, pushing everything to the front. How we can do it? We can create a stopped arch near the premolar, creating a small loop more close to the middle of the molar. Not between premolar and molar, but more close to the middle of the premolar. So when we push the wire in the slots, we will get proclination of the wire, which will push all the front teeth forward. You will see it now in the hands-on demonstration. Another option, as we said, can be to try to push all the teeth forward. Not just the front segment, but all the teeth in a manner of a stopped arch. So you can see here the mushroom passive wire that I bended before. And now I want to make sure that all the segment between 5 to 5 will be pushed forward. So what I will do now is take the wire, place it a little forward, then I will go to the mesial of the molar and do a mark. And same I will do here, and I do a mark. Now, there are two ways that we can do this bend. One is with this nice plier that I've shown you in the beginning of the lecture, and this plier will create for you automatically this stop, as you can see here. You can choose different sizes of this bend according to the steps you have here in the plier. And the other option, you can see here that if I place the band mesial to the molar, then the wire, the whole wire is pushed forward. The second option will be, if you don't have this plier, make the band vertically down, change the position of your hand, around side of the plier, bend it back. Now we got the loop, and all we need to do now is bend the wire now back to the same level. Of course, the plier, the design plier made this band more elegant than this one, but they both do the same work. So if you place now the wire with these two stops, you can see the amount of proclination that we can get. This band is a very, very important band that we should learn, not only for joy brackets, but also for evolution of complicated brackets, which has 3D control. These bands are designed in order to close spaces after we finish the alignment of the teeth. Now, the alignment of the teeth is one of the first stages we do in our treatment sequence. We first do alignment, we correct all rotations, we correct all the in and out, we correct all the up and down. Now, if there were spaces or we have extracted teeth, now we want to close the spaces. So one of the first things we do is stabilize all the segments. How we stabilize the segments? We take metal ligature and we create figure 8 around all these 3 segments. After we have done all these 3 segments, we are doing the wire, which is usually a rectangular, stiff wire, like 16 by 22 stainless steel. We are putting the bands, the mushroom passive bands, close to the cuspid, so the space between cuspid and cuspid will not be open when you retract the teeth. So we create this mushroom shape. And then we take the wire and create some compensation bands horizontally and vertically in order to avoid the teeth from tilting. When we close the spaces, we want to close bodily. We don't want to have tilting. So when we have the chance for tilting, we will do a reverse curve in the wire in order to overcome this tendency. So we will learn in this hands-on part how to do this complicated wire for space closure step. For this purpose of the exercise, you will use metal ligature. To do figure 8 is very easy. You go with the ligature down the bracket, up the bracket. I usually do it under the wire, and so I can put the wire inside and do not need later on to replace this metal ligature. I'm using to cut the metal ligature, I use a normal cutter, and I have here also a lingual a ligature director. You can see it is angulated 45 degrees. Okay, very useful. Of course, you start by preparing the passive mushroom bands. I check the wire to see that it is passive. Okay, and I have the mushroom bands. And now I will show you how we make the compensation for the bowing effect. When we close a space, we don't want we want to avoid the tendency for the teeth to tilt. And that's why we will make an opposite bend in the wire. So this bend should be made both in the horizontal and in the vertical. So that's the way how we do it. I hold the light wire plier, and with my hand, I just with one movement, I create this horizontal shape bend. You can compare now the right part to the left part. Now automatically I get also a vertical movement, which I will now a little bit enlarge. So now I have both vertically and horizontally. Now, when you want to know if the bend is big enough, just imagine where you cut the wire. If this is your arch, the wire will be cut eventually here. So now you can see that the bend that we have made is too small. So I take now and I enlarge the bend a little bit in both dimensions, both horizontally and vertically. So now you will be able to see the effect of this bend on the arch. The molar will get some anti-rotation movement. The premolar will have a tendency to move inside, which is very good in this case. And we will level the curve of Spi. This bend should be made on rectangular wire. The next bend is a very easy but very common and important in our finishing stages. Many times we see a little mistakes done either in our biomechanics or bracket placement of up and down, in and out, right and left, and we need to make some correction bends. These bends are usually made on round wires, 16 beta titanium or CNA as called in Adenta company, which is very easy to bend but still stiff enough in order to hold the teeth. So we will learn in this case how to do an in bend. Now when we take the teeth in, what happens to the tooth? We take them in, they become longer. So the bend should go in and up. In order to move a tooth inside, the bend again should have in and up. So we will learn now how to bend this wire to do this step, step in and up. The same bend can be done on the opposite direction. Now we want to move the tooth out. Now when you move the tooth out, what happened to the tooth? It becomes shorter. So every time when we want to make an out bend, we should also make a down bend. So this step in the wire should go both vertically and horizontally. Let's see how to do it in a hands-on demonstration. In order to create the offset bend, which can be in bend, out bend, up or down, we have two options. One is to take the plier called offset plier, which has one side to do the in bend and the other side to do the out bend. It comes in a few versions, depends on the size of the step, from 1/4 millimeter to 1 millimeter. We hold it wherever you want to make the step. As you can see, it creates a step and leaves the two parts of the wire parallel. And then we go to the other side of the plier and we create the other side of the step. Okay? Usually if you hold the wire properly, then the wire remains flat with a step. A second option will be to take the light wire plier and do the same in a very easy way. If we want to have now an in band, we will take this part out and this part in, and you can see already the in band. And if we want to make now the out band, we make now the opposite. Now, this is of course a little more time consuming, but you can compare these two bands, the one that made by the special plier and the one made by the light wire plier. And beside the fact that I made this one a little bigger than this one, they look almost the same. Step in and step out. The same of course can be made out, up and down. And as I said, normally when we take a band in, it means that the tooth will go down, and then I will have to bend up. If the tooth goes in, it will become longer. So we will need to make here, in this area, the same step up. In the same manner, in the same distance, make the same step up. So when you will hold the wire on a horizontal, you will see a bend in, and on vertical you will see a bend up. This band is also very common, very useful band to do rotation band. Now, why we need rotation band? Actually, if you place the bracket correctly, we should have got all the rotation we needed. Why we don't get the rotation? We don't get the rotation because the interbracket space is so small that the moment, you remember, moments are force double distance. When distance is small, the moment to get the rotations are very small. So we do an active rotation band. As you can see here, this band will be demonstrated in a minute in the hands-on model. But remember, when the rotation is completed, we move again to straight wire, because this band may affect later on the neighboring teeth. We don't want it to happen. We just want to accelerate the rotation. Let's see how we do it. Making rotation band is something we should consider when you want to accelerate the rotation of a certain tooth, or you are lacking of distance in order to create enough moments to rotate the tooth. This is done very easily. We hold the light wire plier, then we create a bend in, a bend out, Then we have just to reshape the wire. So we keep the same passive shape on the other teeth. Now, as you can see here, we have a 45 degrees of bend, which will be close to the tooth on one side and far away from the tooth on the side that we want to rotate. Now, after rotation is completed, it is important to come back to a straight wire which will fit the bracket nicely in order not to get side effects from the neighboring teeth. You should remember that this band is an overcorrection band which aim to help you in the rotation, but this is not the actual position of the brackets on these teeth. The last two bands are quite complicated and not very common in our treatment sequence and are designed to do asymmetry correction. The asymmetry can be vertical or horizontal, and we will demonstrate for you these two options of vertical and horizontal. By recommendation, usually if you need to correct a true asymmetry, to go for 3D bracket, which are placed perfectly in a laboratory or with a CAD/CAM skills, also preferably with computerized robot-made wires. But when you need small corrections, we will see now how to do a vertical asymmetry band wire. The vertical asymmetry band is done by taking, first of all, a nice passive mushroom arch wire with or without the molar band. And then after we design it, you decide where the asymmetry is located, and then you can hold the wire and you decide which side is asymmetrical and where you want to apply the force. So in this case, for example, I will hold it in the cuspid area and push this side up. So now all the wire is tilted up in this area. I can go now to the other side and tilt it back down. So I will have now a shift in the wire to correct the vertical dimension. And the last band, as I told you, will be a horizontal asymmetry wire, which is very, very easy to do. We take a passive mushroom wire, and from the molar, if we want to correct the asymmetry from the molar area, or from more forward, if you want to correct asymmetry only in the anterior part, we do a band which actually shifts all the arch to the left or to the right in order to correct a little bit asymmetry that was previously created by malocclusion or from previous orthodontic treatment. The same can be done horizontally by taking all the wire and moving it inside. So you can see now that everything is shifted in order to create asymmetry in the wire. So when you put the wire in, you can see now that we have a horizontal shift. This is a very, very difficult bend to make, and in such cases it's better to do it in a laboratory and with wires that are bended by a robot to correct a true asymmetry, but small changes of constriction, expansion, up, down of the occlusal plane can be made easily by bending these wires. In summary, what we have learned today. We have learned that wire bending is an essential part in orthodontics, regardless the type of bracket, the type of lingual or buccal appliance, and even in a CAD/CAM customized design bracket, you need to have the skills to bend wires. A little finishing, a little correction, all this should be learned, and this is why I recommend you to go over the hands-on demonstration step by step and improve your skills. I also recommend you to prepare your wires in advance. You know what is the next stage you are going to do in this specific patient. Take the model and prepare your wire in advance. Do the passive bands, the active bands, and put it in the mouth. And the last recommendation, let the wire cook. It takes usually few weeks, sometimes few months for the wire to express. Let all the movements you have placed in your wire to work in the mouth. And don't try to change the wire so frequently, because then one mistake gets on the previous mistake and you lose control. Thank you, and I would love to see you in my next movies on this joy bracket. Bye-bye.